Welcome to our webinar on the microbiome and colorectal cancer. My name is Barry Stein, and I'm the President and CEO of Colorectal Cancer Canada, Canada's national colorectal cancer patients organization, dedicated to colorectal cancer awareness and education, support for patients and their families, and advocacy on their behalf. As a person who had metastatic colon cancer at an early age, I often wondered what the root cause of the disease is, how it could be prevented, how we could improve the treatment of it, and in this case, could we manipulate our gut microbiome to better prevent, detect, or treat the disease? This curiosity led me to being engaged in both basic and clinical research as a patient advocate with the Cancer Research UK's Cancer Grand Challenge, OPTIMISTICC. OPTIMISTICC is the opportunity to investigate the microbiome's impact on science and treatment of colorectal cancer. It is a rich and rewarding experience, and I encourage you to look for opportunities to participate in cancer research that may one day help others prevent the disease, improve patient outcomes, or even find a cure. On behalf of Colorectal Cancer Canada, I'd like to thank Cancer Research UK and Jess Sutcliffe, its program manager, our wonderful researchers and patient advocates of Team OPTIMISTICC, and a special call out to our Team OPTIMISTICC program manager, Jodi Hirschman, and our lead patient advocate, Laura Porter. I'd also like to thank our entire team at Colorectal Cancer Canada for embracing this project, and especially Iris Carey and Maria El-Basri, as well as Nicola Hakim for their fantastic teamwork in putting together this webinar. I hope you'll enjoy these lay interviews with Team OPTIMISTICC researchers, patient advocates in today's webinar as much as we did putting it together. Thank you. And now I'd like to introduce Anne-Marie Wright, who will be our facilitator for today. Take it away, Anne-Marie.
Thank you so much, Barry. It's my very distinct pleasure to be your moderator today to shine a light on the incredible work being done to transform outcomes for people with cancer, and most particularly colorectal cancer around the world. This highly innovative webinar is a result of the collaboration between Cancer Grand Challenges, a global funding initiative founded by the two largest cancer research funders in the world, the Cancer Grand Challenges OPTIMISTICC team and Colorectal Cancer Canada, all of whom you will learn about in a moment. Over the next 3 hours, this collaborative intends to educate and inform on how knowledge of the microbiome will create new research and treatment paradigms for people with colorectal cancer. This is a large and exciting initiative. We've chunked this webinar into 8 approximate 15-minute recorded segments of important content, all presented by the incredible OPTIMISTICC team, researchers, and extraordinary patient advocates from around the world who have worked together to demonstrate the positive impact of collaboration on cancer research. Note, please, that this webinar is actually being taped, and you'll have the opportunity to revisit and share the sessions following the webinar through the collaborative. Please do join us at approximately 12:20 for a live panel Q&A session. Throughout the webinar, also please ask any questions you may have by using the question feature on the platform. Behind the scenes, we have a great team of people who are curating your questions for the panel. You can also use the feature if you need help in any way. So without further ado, I would like to introduce you to Jess Sutcliffe, the Science and Advocacy Lead, Cancer Grand Challenges, and Jodi Hirschman, Research Program Manager, OPTIMISTICC. Both Jess and Jodi have extensive and rich research backgrounds. And all the way from London, England, I'd like to introduce you first to Jess. And may I start with you first, please, Jess? Can you give us a brief overview on the Cancer Grand Challenge initiative, and more specifically, how the OPTIMISTICC and microbiome team and initiative came to be?
Yeah, of course. So Cancer Grand Challenges was founded by Cancer Research UK and the US National Cancer Institute, and we're all about setting ambitious challenges that, if solved, would significantly advance cancer research. And to achieve that, we fund diverse global teams. We give them £20 million, which is approximately 33 million Canadian dollars, and ask them to come together to tackle these issues. So we encourage teams to recruit individuals who haven't necessarily worked in cancer research before. So it's all about that multidisciplinarity and bringing in new views and perspectives. And also really importantly, and it's something you touched on already, collaborate with people affected by cancer. So to embed those patient advocates in their team and to hear that patient voice and to make sure that's reflected in the research that we're funding. We funded 7 teams so far, of which 1 is the OPTIMISTICC team, and we'll actually be announcing another 4 successful teams in June this year. And thinking more about the OPTIMISTICC team themselves, so the OPTIMISTICC team is actually one of 130 teams that applied to the second round of Cancer Grand Challenges, and they were focused on the microbiome challenge. So this challenge was posed by our Cancer Grand Challenges Scientific Committee. The reason being that a lot of evidence had accumulated that suggested the human microbiome could influence cancer development, but also the response to treatment. But lots more exploration was needed to really understand exactly what was happening, to really unravel those mechanisms and to understand like the how rather than just the observations that occurred. And with that how and why, you can start to explore how you could potentially manipulate the composition of the microbiome for patient benefit. And that's exactly what the OPTIMISTICC team are focused on. So the reason they were selected for funding was there was a plethora of reasons, and I'll just go through a few. So the caliber of the team is the first thing I really wanted to highlight. These are world experts in the field, and actually the dynamic that they have together. So clearly coming at this challenge together, sharing ideas and sharing hypotheses moving forwards to address. And also the fact that they are really seeking to understand the role of the microbiome in cancer. So having that fundamental knowledge, but thinking about how that can be translated to make sure that there is patient benefit as well. So working at every step of that research pipeline. So thinking about early detection, thinking about novel treatments. And I know it's something that you'll hear a lot more about later today, but also very topical. They're actually thinking about developing vaccines, how you could target specific elements of the microbiome that we know are negatively associated with colorectal cancer. And that's just one aspect of the program that we're very excited about as funders.
Thank you so much for that tremendously detailed overview of the program. And I'd like now to turn us to Jodi Hirschman, who's the Research Program Manager for OPTIMISTICC. Jodi, can you share with us the OPTIMISTICC key objectives and questions the team is aiming to answer, and how those questions, in fact, have defined many of the work packages and sessions that we'll see throughout this webinar?
Yeah, sure. Well, there are 3 overall objectives for the OPTIMISTICC project. The first is to map the colorectal cancer microbiome in global populations. And you'll hear about this work in the work of work packages 1 and 2. We're looking to understand what are the microbiomes that make up the colorectal, or the microbes rather, that make up the colorectal cancer microbiome. What are those microbes? Are they found in populations around the world? Do they differ in different populations around the world? Do they travel? Secondly, do they travel as groups within the body? So that's more the focus, the biology of the microbiome of work package 3. Do those microbes localize in the tumor? Do they localize in cells of the tumor? What do we know about their biology inside? And so all of that knowledge that we gain, we hope to be able to apply to creating new kinds of diagnostics that would target the microbiome specifically and help us understand who's at risk and how we can help identify patients earlier. The second objective of the OPTIMISTICC program is to test and implement microbiome targeted therapies for colorectal cancer. So this is more a treatment angle, and that's the work of work packages 4, 5, and 6. Work package 4 is focused on model systems for studying therapies. And in particular, you'll hear about organoid technology and the use of organoids as a model system for therapeutic study. Work package 5 is looking at the interplay of current treatments for colorectal cancer, the interplay with the microbiome. So chemotherapy, immunotherapy, and the microbiome. And then also there is an emphasis in work package 5 on early onset colorectal cancer and trying to understand if the microbiome plays a role in that. And then the work of work package 6 is more focused on therapeutics, new therapeutic ideas that would specifically target certain microbes. And so you'll hear about that. And then the third objective is to share and disseminate our results to the public. And that's the role of this webinar today. We want to strip away as much as possible scientific and medical terminology and make the language as plain as we can to help the public, particularly patients and their families, understand what we're doing and what we hope to achieve. So those are our objectives.
Thank you so much to both of you for laying and setting the stage for the next 3 hours. Jodi, you raised the importance of science communicating with the public, and that has been a defining principle of this webinar. And I can think of no better way to start this webinar by than introducing our opening session. I'd like you to welcome, please, Margaret Grayson and Laura Porter, who will be discussing the importance of patient advocates in research. Both Margaret and Laura are rather unique patient advocates. Margaret is a retired healthcare professional and today importantly serves as chair of the Cancer Grand Challenges Advocacy Panel and as a member of the scientific committee. She has partnered with research as a patient since 2010 and strongly believes that excellence in healthcare is based on excellence in research. Margaret had a second cancer diagnosis in September 2021 and is currently undergoing treatment. Dr. Laura Porter is a stage 4 colon cancer survivor and has worked as a patient advocate in a variety of roles, including research, advocacy, grant reviews, and as a medical advisor for advocacy organizations. She is currently a co-investigator on Team OPTIMISTICC, responsible for the recruitment and management of the patient advocates on the project. Margaret and Laura will share how patient advocates can shape research that truly make a difference for others, and most importantly, keep patients at the center of the research first and foremost. Please welcome both Margaret and Laura.
So welcome Dr. Laura Porter and Margaret Grayson, two of my favorite advocates, and looking forward to this fireside chat that we're going to have together today. Laura, could you tell us a little bit about your personal story and what you went through as a patient and also as a physician?
Sure. Thank you. Thank you for this opportunity to talk about this. I was diagnosed at the age of 43 with metastatic colon cancer during my pediatric residency. And one of the things that I would do when I was in the doctor's office, I went to a community hospital, was I would sit there and I would read my chart. And what I found were a lot of mistakes. And so I would tell the doctors about the mistakes that they made and they would correct them, or I would call and have them corrected myself sometimes. And what I realized at the time was that, you know, here I am, a doctor, and I am not being listened to, I'm not being heard, and I'm being not treated properly. Mistakes are being made. And I thought to myself, if this is happening to me, I know how to read a chart. I know what to look for. How are other people that don't have the education managing this? And that was the beginning of my interest in advocacy. I had gotten in touch with a patient advocacy group where I found people that were like me, that were young like me, that were sick like me. And I felt that camaraderie and companionship there. And, you know, the difference between being a patient and being a doctor, you know, I had been a patient years before and during my residency because of having a knee replacement and multiple knee surgeries. But now it was different. It was a matter of life and death. And I think that that's what really made the difference for me was life and death, and having the knowledge that other people may not have.
And through that experience, both as a physician and as a patient, and also interacting with other patients, how did you gain an interest in doing research? I know that you had a previous interest in research for sure, but did this change anything? Did this make it more impactful? And did you have a different perspective on doing research?
The difference that it made for me, being a patient now, was there was more of an urgency. And I want to say that losing so many people over the years, it's, what can I do? And the bottom line is that as much as I would like to have everybody live and survive like I have, that's not in my power. So now what's in my power is to support research that can make a difference.
You were approached to become involved with Cancer Research UK's Grand Challenge, what we call Team OPTIMISTICC, in terms of the microbiome and colorectal cancer. How did you get involved in this project?
So I spoke with Kimmy Yang, and I spoke with Matthew Meyerson, and and so I became part of the project. And I really do believe that all of the advocacy, all of the panels that I was on, all of the things that I had done up until that point prepared me for this incredible opportunity to be one of the co-investigators on Team OPTIMISTICC. And I am incredibly grateful for that. I was involved in writing the grant, reading the entire grant. I didn't understand hardly any of it, even though I had done a lot of research. But doing the budget, choosing the advocates to be on the team, and just an incredible opportunity. And
you do it so well. And dealing with all the different advocates from all over the world, what type of experience are you having, and what type of input are you and the other advocates, including myself, having on the research in OPTIMISTICC?
Well, I think that I think the first thing to realize is that most of the scientists, and they are from all over the world, there's many, and physicians have not worked with advocates before. So it was a new experience for them. And advocates from the United States, I don't believe we have worked in the capacity that we work with Team OPTIMISTICC. And it has been a learning process, sometimes positive and sometimes a little less positive, but we just get through it. It is very difficult to totally integrate advocates into the work packages. We have 6 work packages, which are basic cancer research. And so you can put it in as lay terms as you want, and it's still difficult. But, it's about what happens in the future. And I think that that advocates from different countries bring different perspectives on what's done. I think particularly with the UK, because they do things so much different as far as screening is concerned than what we do here in the United States.
And do you feel that the researchers have been impacted by the participation of the patient researchers and patient advocates?
Yes, I absolutely do. I think that, we do an annual review, and I find it incredible that the first thing that is mentioned at the annual review are the dedication of the patient advocates. And and how integral they are in the project. But I think having patients there just reminds the researchers of what they're doing, you know? And I think that that's what's really important, even in the basic sciences.
Right, excellent, and I think you really hit the nail on the head. It is a two-way learning experience, both for the patients and for the patient advocates. I want to carry on with Margaret. Margaret, I'd love to hear a little bit about your personal story and how you became involved in research, in particular with Cancer Research UK.
Okay, thank you, Barry, and thank you, Laura, and hello to everybody. Thank you to be here and be part of OPTIMISTICC for today. I think that's just tremendous. I've followed what OPTIMISTICC has been doing right through the application, right to this point in time. So thank you for that privilege. A little quick background. My world was as a therapy radiographer, so I was used to the words around oncology, around cancer, but I had a specific interest in psychosocial oncology and held a specific role on that. But back in 2004, I was 54 at the time, I walked into a room and while my diagnosis might be breast cancer, it is no different to anybody going in and hearing those three words, really, you have cancer. And for me, I really felt as I walked in as a person. Here was Margaret in control of her life. Margaret knew what she was doing the next day, knew what she was doing with the family, all of that. And yet those three words, I walked out of the room with a patient label. And I really think with that patient label, there comes a great sense of vulnerability, a sense of being out of control of your life. Your life is taken over with appointments for scans, appointments with doctors, appointments with things that you would never have expected to undertake normally in your life. And that was the start of my treatment journey. The treatment lasted for 10 months. And it really didn't make any difference that I had knowledge about cancer. I did have that knowledge, but when you change chairs, then I do think when you get that patient label, you have the same vulnerability as everyone else, the same fears about the word cancer. And especially when you come out of treatment and finish, that whole fear of getting up each day thinking, is this the day my cancer is going to come back? And how do you cope with that? Because let's face it, if that's what we think about every morning when we get up, it doesn't stop it happening. It doesn't make it happening, but it robs you of living. And I think that's a big area of working together as patients that we can look at. But as I was going through treatment, I really came to realize that my whole treatment plan, my surgery, my chemotherapy, my radiotherapy, my hormone treatment was all based on research. And wow, that was big for me. And as I came out of treatment, I didn't realize how much confidence I'd lost as a person. The fact that my daughter said, let's do a trip and book it in 3 months to go to Paris. And I thought, goodness, I don't know whether I'll still be alive in 3 months. Do I do that? And so it's sharing and understanding with other patients about what the impact is, not just on you, but on your family, massive impact. As I went through treatment, then I went back to work within the cancer centre in I should have said I lived in Belfast in Northern Ireland, and I went back to work, but I decided that if I lived to 60, I would retire and do other things. Didn't know what other things, but I would do that. And I did, but about 6 months after I retired, I had a phone call from one of the professors, the clinical director for the Northern Ireland Cancer Trials Network, about doing something, this involvement in research as a patient. Now, I wasn't really too sure what they meant by involvement in research, but I thought that sounds different. Now, that was 11 years ago. I really became hooked about research, the passion, the reasoning behind it. And so that surprised me, how much the passion has been. And I think that's why all of you who are advocates in OPTIMISTICC have that same passion. And that is my passion. I briefly share those reasons for the passion. is simply my way of giving back my treatment. You know, patients had said yes to clinical trials years before. I'd love to go back and say thank you to them and to the researchers, because they made a difference to me in my life and what has happened to me. I became involved with Cancer Research UK back in 2014, and then in 2015 with Grand Challenge. I have the privilege of chairing the Cancer Grand Challenges advocacy panel and sitting on the Grand Challenge Scientific Committee. What do we look at in advocacy? Wow, it's so exciting when I hear what you're doing in OPTIMISTICC. To me, Grand Challenge, okay, Cancer Grand Challenge is big, it is bold, it is outside the box thinking. And that's what, when we see the applications for the awards and we see the plans that you have for advocacy, then we're looking for innovative ways of embedding the voice of patients or of carers, people who've been impacted by cancer, within those challenges. They are collaborations, they are multidisciplinary, they are global, but that involves the patient voice. That's what excites me about the Cancer Grand Challenges. That's what excites me about OPTIMISTICC. When I look and see your posters you've made, when I've seen the booklets that you've worked on, it's not easy to be part of basic science. It's a learning process, but it's a two-way conversation. It's a listening to and a speaking to and with. And so it excites me. OPTIMISTICC excites me for the world of those who are diagnosed with colorectal cancer. So yes, I'm passionate. I had a second diagnosis, my first 17 years ago. I had a second diagnosis in September 2021. And that's why there's no hair today, because I'm in the midst of my chemotherapy. And research, this time I'm having some different drugs. Why? Because of research. So yes, I'm passionate. Sorry, I'll then bring down the passion a little bit. We see that the embedding of patient advocates perhaps within your case, different work packages within the strategy of setting of what is being asked. But we don't want to see tick boxes. We want to see advocacy, patient advocacy, as being real, as being of value. And all the patient advocates that I have worked with within the Cancer Grand Challenges, this is one thing I would say. Our passion is great. The passion of the researchers is also great. The passion of the researchers is they want to find that answer to what is happening to colorectal cancer and the microbiome, or whatever the challenges they're working on. Their passion is also great. I am amazed at them because it's more than just a 9-to-5 job, okay? They have a passion. But what do I bring, and what does any patient advocate bring to that research table? I'm not a scientist. In 11 years, I haven't become a scientist. I haven't become a researcher. I'm there because of my patient experience. But what we bring as patients to that table, these are the experts. They have years of knowledge and experience in their specific field. I'm an expert as well. I'm an expert in living with cancer, in going through the treatments, and knowing what that means. So to me, advocacy is that partnership, because bring two areas of the expertise together and look at the excellence that you get in research. And so that's why I would encourage any person who has had an experience of cancer to be able to find a way to bring that voice, that experience to the research table. And it's exciting. But I see patient advocacy as being central to each of those awards and in any area of research. So yeah, it's good. And people, so many different people who think I could never be anything in research as an advocate, but that whole mentoring, that whole learning together, that whole explanation, and being that link that tell us that also the public involvement is being part of that research and those research decisions. The engagement bit is telling others, well, what is it that we're doing? And that's also important. But being that link, being able to say to someone, that's not really how people in the public or other patients would understand your terminology. Speak from scientists and researchers, because they publish, is very different. And that's where working with patient advocates brings such a richness in learning that lay summary, in keeping researchers focused, even in the world of basic science, that ultimately the research will be of benefit to patients. And in OPTIMISTICC's case, it's for people who have a colorectal diagnosis, of be of benefit to them, to the whole health system. We all want excellence in healthcare. If you ask anybody who's listening to this, excellence in healthcare, that's only possible if there's excellence in research. So, sorry.
I don't know what more to say, Margaret and Laura. It's such a pleasure to have had this opportunity to have this short discussion together. But even in this short time, I feel like I've got to know both of you so much better than before. And in your case, Margaret, amazing to meet you today and to have this discussion. Thank you both for everything that you're doing as patient advocates. I wish you both continued good health and excellent treatments going forward, so that you don't have to do this again.
Okay, thank you, Barry.
Thank you, Barry. Thank you, Margaret.
Indeed, that was incredible. It is with many thanks to Laura and Margaret in particular for their sharing, their passion and their enthusiasm. It's very hard to see that the value that they bring to the table through lived experience is undeniable. I'd also like to acknowledge Barry Stein, who is a patient advocate himself as part of the OPTIMISTICC team, very deeply engaged in this work, bringing the kind of trailblazing and groundbreaking thinking that each member of this team has defined as part of the work. It's important to acknowledge that the work that the OPTIMISTICC team is doing, as Laura pointed out, is new. And they are learning as they go. And as part of the project, not just the physical research work in redefining cancer and colon cancer treatments, et cetera, there is the whole world of how the process in creating these new treatment paradigms is created. So thank you very much for an incredible session.